Namaste and good afternoon. Welcome to today's Facebook Live session presented by Apollo Hospitals. This is Dr. Srinidhi Chidambaram, and I do hope that you're all doing well and staying safe. We hear of lockdowns less and less, and the world is now learning or has already learned to open up and live with the COVID virus. But the virus can resurface, can cross borders, can cross nations and buildings and strike in several new mutant forms. So it's very important to accept this rather unfortunate truth and make sure that we are constantly updated and aware about the latest aspects of COVID-19 while continuing to follow all precautions and also taking the vaccine on time. Today, we are going to address one important emerging aspect of COVID-19. In the initial days of the pandemic, we didn't really hear so much about people catching the COVID-19 infection again and again. But with the Omicron variant, which emerged last November, this has changed, and we do hear of a lot of COVID reinfections. The Omicron variant, while being less severe and causing less complications and severe disease, has been definitely seen to have a higher transmission rate and also perhaps an increase in reinfection rate. So we need to know all about COVID reinfection, and to explain this to us and enlighten us, I'm very happy to welcome Dr. Ravikiran Barigala, who is a senior consultant in infectious diseases at Apollo Hospitals, Jubilee Hills, Hyderabad. Dr. Barigala completed his MBBS from the Osmania Medical College and did his master's in public health at the Western Kentucky University in the US. And then his internal medicine residency was also done at Chicago. He's also done an infectious disease fellowship from the University of Wisconsin in the US, and from 2015 has been with Apollo. He has several publications in various international and national journals, and also participated in several conferences and presentations. He won the Young Investigator Award from the American Transplant Congress from Toronto, and has been very active in his teaching and mentoring role, mentoring several students from US and India on projects, and also a teaching instructor at Medvarsity of Apollo, and also part of the Apollo Institute of Medical Science and Research. He's also been an internship instructor for several pharmacy interns at Apollo Hospitals at Hyderabad. Professional memberships have been numerous, where there has been, he's a member of the Clinical Infectious Disease Society of America, Telangana Medical Council, AIDS Society of India, and American Medical Association, and many more. Also has been American Board of Internal Medicine certified in 2006 and 16, and also certified with the American Board of Internal Medicine and Infectious Diseases in 2009 and 19. Welcome, Dr. Barigala, to this discussion. So we're all eager to find out what about COVID reinfection and how much at risk we all are. Over to you.
Thank you, Dr. Srinidhi. Thank you for that introduction and kind words. So we are here today talking about COVID-19, and that's what we've been talking a lot about for the last 2 years almost. We've been in this platform before where we were talking about COVID-19, and here we are again talking about the COVID-19 reinfection. So specifically our talk is going to be about the reinfections of COVID, who gets it, how does it look like, how can we diagnose it, how do we differentiate it, and what are the long-term complications. So that is kind of the general outline that I would lay it out. So just starting off, just a few words, and then I can have Dr. Srinidhi ask more questions about it. So just COVID-19, as we know, it's been around for 2+ years now. And in India itself has caused probably lakhs of deaths. I don't know how many exactly. There's debate about the numbers of deaths or the number of infections. Let's not get into that, but hardly anybody is left in India that we know of who has not been affected directly or indirectly. That's been the widespread impact of COVID on everybody. And the impact has been directly on health or their livelihoods or the just social and economies, industries, research, everything has been impacted. Um, some good things have also come out of this in terms of innovation, like a lot of this Facebook and online media has exploded. So some good things also there. In terms of health, and that's where my field is, I will be addressing more about those things. Initially, when we first got COVID, there was a thought that if you get COVID, you're not going to get COVID again. And that was the first few days. And I think even I went on TV and programs and I said, yeah, if you get it, then you will never get it again. We'll all be safe. This virus will just go away. Once everybody's infected, everybody is going to just be fine. But within 2 or 3 months, we were proved wrong when we started seeing reinfections again. For people who were already infected, for, let's say in the first wave, March, April, May of 2020. And then we started seeing reinfections probably from June onwards. And then we said, well, even if you get reinfections, it's not going to be severe. It's only just going to be a mild illness and it will all just go away. And we were proved wrong in the second wave. We got a big second wave, which was really, really bad, which was much worse than the first wave. So we were all in a way humbled by the second wave. And we said, okay, yeah, we were wrong. It can actually be bad. And then finally the third wave hit. And the third wave has actually in a way proved us right, finally, where the people who were reinfected, actually the population which was impacted by the third wave, which is the Omicron wave, which kind of started out in December, January, and quickly fizzled out because it infected everybody. And then it pretty fast just kind of went away. Starting from February onwards, at least in our hospital in Apollo, we had to close down all the wards. In the last 3 months, we have had no inpatients at all. Everything is just shut down. Even in the outpatient settings, we've hardly seen any patients these days. So the numbers have really gone down. But does this mean COVID will not come back? Will we never get COVID infection again? That's not true, because we still keep getting it. Even now, I keep getting calls. We do testings and we still find COVID is still there. It is not completely gone. And you keep hearing about cases all across the world, like China has gone through a huge pandemic. South Korea, Hong Kong, and many other countries are still going through major outbreaks still. So COVID is still around. And as long as one country has it, nobody's out of it yet.
Yes, indeed.
Right.
So what exactly is a COVID reinfection defined as? Like, is there some time frame or is there some definition for it?
Right. So it is not a specific definition. Like you do a blood pressure and it crosses, let's say, 120 or 140, we tell you that, right, this is high blood pressure. For COVID reinfection, there is not necessarily such well-defined criteria where we can say this is a reinfection. We can say it is an infection. Okay, is it a reinfection? We'll have to base it on a few other parameters. First things, have you had a COVID infection before? If you had in the past, definitely this is a reinfection. But have you had a COVID infection or not? Sometimes it's not very, very clear. Because you may have had an infection, but you may not have symptoms before, which is actually probably majority of the COVID cases. More than 50% may actually be asymptomatic or subclinical or only a very mildly clinical infections. We've had 3 waves. Probably in India, most of us have been exposed to some extent. So we may have had COVID. We don't know. When they did serological surveys, even after the first wave, 50 to 60% of Indians were affected by the first wave itself. And then much more by second wave, and even more by third wave. So if you combine all of them, probably vast majority of Indians, even worldwide, have been affected or infected with COVID at some point during this time. and the antibodies will be there. The problem will be is about will the antibodies be there for all the time, and do we have good enough tests to know the antibodies, at what antibody levels do you call it actually as a protective and not? We don't have those definitive cutoffs. So how we define as COVID reinfection generally clinically is more on a clinical basis. So let's say somebody has a documented or a clear symptomatic COVID infection, gets better, and then gets a new set of symptoms, same or a different set of symptoms, and we test them for COVID, and the COVID comes back positive. So we need to have a documented COVID before, a positive infection by some testing or clear symptoms, and then some time frame of a gap, and then new set of symptoms. That we would clearly define as a COVID reinfection. And this is more of a clinical diagnosis, not just a lab diagnosis.
So how common are COVID reinfections at this point?
Exactly. So the burden of COVID in this country has gone down significantly now. Earlier, let's say I would be seeing, like in January, in the middle of the third wave, I was seeing 10 to 20 new cases every single day, personally. And in the last 3 months after that, probably I have seen 10 cases total. So that's the number of cases which have dropped. Huge drop is there in the number of cases now, and seems to be localized also in some cases. Like Delhi had a lot more infection recently. Some cases in Mumbai, some cases in Gujarat. We're not seeing that much in Hyderabad and many other parts of the country right now. And that is where we are trying to address this all India right now. Very, very few cases of COVID all across India. So the prevalence is extremely low. But so how will we find out if it is COVID or not? First thing is we are looking for the symptoms. We are not doing random testing at this point. If somebody clearly has a symptom, we are checking for COVID. But in fact, majority of the times what we are finding in this day and age is it's more than 90% of the time, it is actually some other viral infection or some pneumonia which is causing upper respiratory tract or a lower respiratory tract type of symptoms. Less likely to be COVID, although we cannot rule it out. So somebody comes in with the typical symptoms of COVID, cough, cold, fever, headaches, body pains, things like that, what we know already. We should still check for COVID. And if they've had COVID in the past already, we would call it a reinfection.
So is there some time frame for instance, if somebody has COVID-19 infection, is there a period where they can reasonably assume that they will not get a reinfection? Yes. Or is it like highly variable?
It is a very variable number. The shortest gap that I have found is about 2 weeks.
2 weeks.
2 weeks.
That's short.
The longest is almost 2 years, because somebody who got it in 2020 initially has gotten it again now in like the third wave. So that's the longest. So that's the shortest to the longest. That's been the gap. So it's a huge gap exists. But the shortest gap is there when there was a complete shift between the virus. So somebody, and we were able to prove that, like somebody got it from the Delta variant and got better, completely better, fully recovered, came back to completely baseline, and then got the Omicron, which was a completely new type of a strain of the virus. And then they got symptoms again. And then we tested it, there was some, the S gene, all that was different. And we had done it both those times, and we were able to prove it that this was actually a different strain. So you could get it even in a very, very short time if the strain is completely a new type of strain. With the same strain, what I have found in my experience, it is unlikely to get it again in the 3 months with the same strain. It's probably even much longer than that, because most of us have already been vaccinated. So if somebody gets COVID, let's say now, most likely you will not get that same strain of COVID in the near future. to 3 months or probably even more than 6 months, because we have the antibodies still remaining in our bodies. And many of us are also eligible for a booster dose. So if you have not taken a booster dose, that has to be done. That will help us.
So this brings us to the question of immunity, really. So whether infected with a previous strain like the Delta or vaccinated. So when it comes to a new strain, does that mean that these things don't, I mean, how do they impact getting the infection or the severity of the disease? Because then people might wonder, then why are we getting vaccinated if we are anyway going to get infected with
Right.
a new variant?
Right, definitely. A good question. So, if we are vaccinated, we have several studies, and my own personal experience and a lot of other doctors' experience has shown that the severity of the illness for people who are vaccinated is much, 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 much less. Like a very good validated studies have been done in the US, which have shown more than 90%, even 95+% drop in mortality among the vaccinated. So even now, if you say in the US, majority of the patients who are actually hospitalized in the US and who are still dying in the US is among the unvaccinated or partially vaccinated or vaccinated a long time ago and have not received the booster doses. Most of the developed or developing countries have given vaccines and are giving booster doses, because what we are finding out is the immunity didn't seem to last a long time. So if as the immunity level from the vaccine is going down or the infection itself is going down, then you might need a booster dosages. So people who have not had those are having severe disease and death. So that is the point of the vaccine. When we first thought of the vaccines, and as we think about childhood vaccinations, actually, we think we take a vaccine and you will not get, like you take a polio vaccine and you will never get polio, right? Or you take a measles vaccine and you will never get measles. But for COVID, the strategy is not to prevent infection. The strategy with the vaccine is to prevent severe infection and death or hospitalization. That is what it kills our economy. It makes us really, really sick. It makes everybody worried. It keeps us at home. Those things we are trying to prevent by the vaccine, not just a simple infection.
So when we talk about immunity, either from the vaccine or from previous infection, there was a time during the first wave and even during the second wave where everybody was measuring their antibodies and comparing and, saying, oh, I have 120, you have only 2. So we don't do that much these days. So what exactly is the role of the different types of immunity in preventing reinfection? And also the other question is, does that wane over time after an infection or a vaccination?
Yeah, that's a very good question. So I know so many people who used to check it, and if they don't have it, they would take another vaccine. If they don't have it, they would take another vaccine somehow, some way. But that is not proven by any scientific literature. That is the thing that you should be doing on a routine basis. This should be done as a research study. Okay. So I personally have not checked my COVID antibodies to date, and I have not checked it for any of my family members, my wife, my kids, my parents, and I have not personally recommended for any of my patients. Have people done that? Of course, they have done that, but is there an evidence that doing that is a good practice? I don't think so, because there is no clinical data which suggests doing that changes outcomes. By doing that, we should give more vaccines. There is no data based on that, because what you are actually measuring is one antibody level, but there may be different types of antibodies. And actually immunity is a two-phased immunity, two types of immunity. One is an antibody immunity, which is we call as a B cell immunity. There's a different type of antibody, different type of immunity, which is called as a T cell immunity, which are different type of cells, which are more stored cells in different cells, in different organs of the body, like the liver or the spleen or the lymph node or bone marrow, which there is no way on a routine basis we can check that levels. Or we can just do a liver biopsy and we can see some T cells, and we can say, yes, there is a T cell. Now you have immunity. There is no consensus among scientists right now in terms of which test to do, how do you measure it, and is there an adequate level? There is absolutely no consensus, and that is not how we practice for any infection actually. We don't keep checking, your antibody levels or T cell and immunity levels for, let's say, measles or rabies or any other things. We don't do that. There is only a few situations it has to be done. And I don't think there's any convincing evidence that we should be checking it on a routine basis. If done, it should be done as a research protocol to further science. We should not be doing it on a routine basis. Does it fall? Of course it falls. But what we are measuring is the B cell immunity, which is the antibody. That will, of course, fall. Immunity first goes up. The curve is like this. So it goes up, it stays high for some time, and then slowly over time, it will go down. It takes 3 months, 6 months, or 1 year. Slowly, it will go down. After that point, you may not necessarily find adequate antibodies in your blood, but that does not mean you don't have immunity. You have the T cells, which are the memory cells. So the body remembers that there is something. If I was exposed to something, it is in a way like if you had a bad experience, let's say with some person that you don't like that person, you remember that feeling, right? And that feeling doesn't go away. You may have Dr. Srinidhi, or I'm sure I have those people in my life where even in my college days, I had a bad something with somebody and we don't really talk, we don't meet. And I don't keep thinking about it every single day. Oh, that person did that to me. I don't think like that. But even 20 years later, I might run into them, I meet them. I'm like, why did I meet this person?
Yeah.
Those feelings just immediately come. This guy did that to me 20 years ago. So you remember that feeling because it's somewhere deep hidden there.
Yes.
In a similar way, T cells are like that. They just let your body be sensitive to this virus and it will remain. And if you are exposed again to this virus, it will start reacting very fast and it will start fighting against that virus. And that immunity stays. However, if there is a completely new strain of virus, we will not get it. So let's say, like I gave you the example of a person, you might have some negative feelings or negative experience in the past. But let's say they change their appearance completely. Yeah. How will you recognize that? I look very differently with the way that I looked 20 years ago. People gain weight, they lose weight, they get gray hair, they lose hair. You might not even recognize them anymore. So you won't even have a response to them. They're like, unless they come and they start talking and they're reminding you of the same things again. Yeah. Oh, we went to college together, we did that together. And then that response might be triggered. So in the similar way, once a completely new strain of virus comes, we still will probably recognize, even if it's a completely brand new, we still will have some immunity to it. Maybe not as strong, but at least partial immunity.
So are these COVID reinfections, what you're seeing, are they actually milder compared to, the complete full blown?
Definitely. If it is the same strain of the virus, definitely it is a mild infection. We've had several cases like that. In first wave, second wave. In the third wave, we do not find much reinfection with Omicron again. I've not necessarily found that. So generally, even the earlier Delta or Alpha variants which we've had in the past, even if they got it, the infections have been much, much milder. Right now, the chances of even getting the mild infections are very low because most of us are vaccinated 2 or even 3 times. And we may have had an infection 2 or 3 times.
Yeah. So that brings me to the last 2 questions before we take a couple of questions coming live on the feed. So one thing I wanted to ask is, the vaccines have not changed, like the flu vaccine, we don't have new versions of it. But at the same time, I think people who have taken a booster, it's going to be, at least the first lot, it's going to be almost 4-5 months since the booster was taken. And in other countries, they are doing another second booster. So does this mean that you have to keep taking boosters all the time, like the flu vaccine, or even some countries have now travel regulations where they say that after 280 days, the whole thing is not valid. So what does this really mean for our lives? Do we have to keep taking this, or will we even be permitted to take it because it needs to be, you need to allow the second round to start?
Right. So that's a very good question. How many times do we keep taking vaccines? I'm sure you must have seen, and our viewers must have seen all those WhatsApp forwards where you have like 10 booster doses, right? All on your arm, 2020, 21, 22, and then you keep taking it. And we're all, I'm sure, sick of vaccines now. How many times can you keep taking? So I cannot say for sure, but my guess is we probably won't keep needing vaccines forever. Definitely not. I don't think it would become like an influenza. I don't think so. And influenza also, actually, there is a change every year. That is why we are taking a vaccine, influenza vaccine, every year, because the strains of influenza change every single year. So I take an influenza vaccine every single year because there is a new strain. What immunity I had last year, it has changed to something else this year. So I have to take a new one. So if the strains, the circulating strains of COVID, and I think that is what it will evolve into. The WHO usually monitors the influenza strains in different countries, northern hemisphere and southern hemisphere, because the cold and weather patterns influence the influenza. In the same way, there will be a monitoring setup that already exists, and it will be probably more streamlined to pick up which variants are coming in which countries, in which seasons. Based on that, they would probably recommend vaccination if the number of infections is significant. Okay, if the number of infections is not significant, like you see avian influenza, okay, those pandemics are small cases, I mean, not a pandemic, sorry, uh, but we don't recommend any vaccine for that, right? Even the influenza vaccine, we don't necessarily recommend for the whole population. We only recommend it in the high risk groups. So we might recommend a booster dosages for certain high risk um, populations or high risk individuals, like doctors who are more in contact with patients who might have infection. Those might be required to take a vaccine in the future. And that also might evolve. And if the COVID cases truly go down, which seems to be the cases right now, the trend, and at that point, we probably will not keep taking vaccines anymore.
So we have to now conclude the session, but I'm going to read out one question which has come from our feed. I got infected with COVID just a month ago, and I recently met a positive person. So can I get infected again?
That's a good question. If you had infection just a month ago, um, your chances of getting reinfection are very, very low. I think it's extremely low, because the strain that is still circulating, at least in India right now, is the Omicron strain. It is um, not a new strains have necessarily come in, although there is some reports in Delhi, the new strain which has come, a slightly different strain of Omicron. So in that way, it is slightly different, but it is unlikely that you would get it so soon by the same strain. But we should still avoid people if they are having COVID or COVID-like symptoms. I think you should be safe. I don't think we should worry about it too much. But if somebody has COVID, a known COVID, or a clearly COVID-like symptoms, I think it is better to be safe, to avoid them. Or if we truly have to meet them, better to still, if there's a confirmed COVID, use an N95 mask if we are around people like that.
So thank you, Doctor, for this very illuminating discussion. And I think it's kind of really thrown light. And I think the message here is that, COVID reinfections can happen, but I think the key thing for people to remember is that the vaccine really does reduce the severity of reinfection, whether there is a reinfection or not. The severity is what really matters. So I would leave you, dear viewers, with the message that please continue to be sensible, follow precautions, find out what's latest. COVID-19 may be at a low right now, but it's always good to stay informed and stay vaccinated. So in light of these emerging aspects of COVID-19, I would only urge you that it's still worthwhile to remember our old SMS, which is the sanitization mask and social distancing in an appropriate way, because nowadays everything has opened up. But as doctor said, it's always good to be alert and aware of people with symptoms around you and stay protected. So do follow us on our social media channels, and we're always there to assist you at any time. So then please stay safe, stay well, stay healthy. Thank you and namaste.
Thank you very much, Dr. Thank you, Dr. Srinidhi, and thank you for this platform. So please take care. COVID is still around. It's not gone away completely. So just please still be safe. Thank you.